Hello guys, so this is Dr. Krishna and today I shall be discussing the lower limb. So before we start lower limb, the first important thing I want to tell you is that we shall start discussing with the bones of the lower limb, okay? So this is something that is very basic, which is not basically asked in your exams, but if you are an MBBS student, right, studying first year anatomy or second year, then this is very much important for you because you have to know the basics, right? So let us start discussing, and what are the important points that will be asked in the exams and all, I'll be telling you later on, okay? So as I'll be discussing in between, I'll include those points. So coming to the bones of lower limb, as you can see this picture over here, this is a pelvic bone, right? Now you know there are two halves of pelvic bone. All of you know that there is right half, there is left half. अभी ये center में क्या है? What is the thing which is in the center? See this one, this is called as your sacrum, right? And this is called as a right pelvic bone. This is called as your left pelvic bone. No, this is something very basic which all of you might have known this, okay? Okay, let us, if we go into further details, if you can see here, this bone over here is called as the iliac bone. Okay, so let me change another color. So this bone over here is called as iliac bone. Okay, so both of them are the iliac bones. Now, if you look at the iliac bones, if you see here, you see this line which I am drawing all the way here, this line is called as the iliac crest. Okay, for example, let me show it to you here. This is your one side, okay, one side of the bone. See this part which you can see here, this is called as the iliac crest, okay. So this part over here is called as your iliac crest, okay. And here I know the picture is not that clear, but here you can actually appreciate one small tubercle, okay. So if you see here, right, in the front here you have a tubercle which is thick, this tubercle is called as tubercle of iliac crest, okay. This is called as tubercle of iliac crest, tubercle of iliac crest. So this one is called as a tubercle of iliac crest. Second important thing is that you can see a small spine in the anterior side here, this is called as anterior superior iliac spine, okay. Why it is anterior superior iliac spine? Because this pelvis you are looking at an anterior view. So superior, why? Because it is on the top, and it is a spine of what? Ilium, ischium or pubis. It is a spine of the iliac bone, so iliac spine. So anything just below that spine, it means this one, right? So this is also anterior, so I will write it as anterior. But is it superior or inferior? It is inferior, right? So anterior inferior iliac spine. So one is called as your anterior superior iliac spine and the other one is called as your anterior inferior iliac spine. So till here I hope all of you understood. Second important thing is that look at the line which I am drawing. See this bone, whatever I am drawing here, this is called as your pubic bone, okay. Now if you carefully look at the pubic bone, there are three surfaces or three rami of the pubic bone, so if you look here, this one is called as your superior rami of the pubic bone, or you can call it as superior pubic rami, right? And this one over here is called as the middle pubic rami, and this one over here is called as the inferior pubic rami, So we have got three types of rami: superior, middle as well as inferior pubic rami. Clear all of you, right? Next important thing is that, so let me show it to you here also, right? So as you can see, this is a superior pubic rami, right? Superior, and this one is the middle and this is the inferior pubic rami. Clear? Now on the superior pubic rami, can you see a small bumpy elevation here, right? This bumpy elevation is nothing but called as pubic tubercle, okay. So the same thing I'm drawing it right now here, you see. So here you have got a pubic tubercle like this. This is the thing, okay. So you see this bumpy elevation which you can see here, right? So this bumpy elevation is called as your pubic tubercle. This is called as pubic tubercle. And in the center, whatever you can see, this yellow color shade, whatever I'm doing, this is called as your pubic symphysis. So this is called as your pubic symphysis. ठीक है, this is called as a pubic symphysis. Right. So I hope you understood all these things here. Right. Let us revise at the end of the class. But now let us move on to the next part. In the next part, the same picture, right? So the same picture, previously I was showing it to you anterior like this, right? So I have little bit bent this picture forward. Okay. So the same picture with a little bent, that's it. Now here you can see two important things. What are those two important things are? You can see a curvature here. On both the sides you can see a curvature, right? And down also you can see a curvature here, right? Now, okay, before I tell you this, let me make you understand one very important point. Can you see a small spine here? Yes or no? Right? So, on the other hand, I'm drawing, this is a small spine. This spine over here which is there, right? So, this spine over here is called as your ischial spine. Ischial spine. This is called as your ischial spine. Okay? Above the ischial spine, you see a small curvature like this, right? And below the ischial spine also you see a curvature. But out of these, which is greater? The upper one above the spine is greater, right? So that is why it is called as greater sciatic notch. Okay, so this one is called as your greater sciatic notch. अभी एक greater हो गए तो दूसरा क्या होगा? What will be the other one? That will be called as lesser sciatic notch. This is called as lesser sciatic notch. Okay, one is called as greater sciatic notch, another one is called as lesser sciatic notch. And by the way, in this previous picture which you can see here, right? In the previous picture, this yellow color shade which I'm doing right now, all of you look here. This is called as obturator foramen. Okay, so this is called as obturator foramen. This is called as your obturator foramen. Right. Now after this, we have talked about greater sciatic and lesser sciatic. Let me show this sciatic notch to you guys. So all of you can see here, you know, when I'm putting a bone in this way, right? This is your anterior aspect, you know, this is your anterior aspect. Now here you can see two curvatures. See, you see this curvature over here, right? So this curvature is called as a greater sciatic notch, and you can see a smaller curvature. This is called as lesser sciatic notch. In between both of them, you see a spine here. This is called as ischial spine. Okay, one is called as a greater sciatic notch, lesser sciatic notch, and in between you have got the ischial spine. So the same picture I'm gonna show it to you from the side here. Okay, so don't worry about this. Just look at this picture. This is how I am projecting it. Okay, so this is how I am showing it to you. Clear? This is the, yeah, rather this would be the picture, I think. Yeah, this is the exact picture which I've kept it over there. So all of you look here now, right? And by the way, one very important thing I want to tell you is that there are two surfaces in the pelvic bone. One is called inner surface, another one is called as the outer surface. Now, I'm showing it to you like this, right? Here will be another pelvic bone, you know. You see, this is called as, what is this called as? This is called as the acetabulum, right? So acetabulum is always projected right side. I mean, acetabulum is always projected outwards. So wherever this acetabulum is there, wherever it is projected, so this surface is called as the outer surface, right? This surface is called as the inner surface. Keep that thing in mind, okay? So wherever acetabulum is there, that is the outer surface, and this will be the inner surface. Now tell me that what surface is this if I'm projecting it like that? Yeah, so all of you look at this picture here. Now in this picture, what surface am I showing it to you? I'm not showing either it is outer surface or inner surface. I'm just putting up the picture in this way exactly, right? So this way which you are seeing here, this is the inner surface again, and this back side is called as your outer surface, right? So in this picture, what are the things you can appreciate over here? In this picture, you can see that there is iliac crest, right? All of you just revise whatever I'm telling. The same things I've spoken before. This is called as iliac crest. Okay? Iliac crest ke baad, can you see a small bumpy elevation over here? Right? So let me zoom in. Can you see it? So this bumpy elevation which you can see is called as your crest. That was the crest which I told you before, hai na? Tubercle of iliac crest. So this is called as a tubercle of iliac crest, which I've just told you in the first picture there. right? Now after that, where is a greater and lesser sciatic notch? Ye dekho. This is called as a greater sciatic notch and this is called as a lesser sciatic notch. Okay, so this one over here is called as the greater sciatic notch and this one over here is called as the lesser sciatic notch. Okay, second important thing is that, so as you can see here, this is the anterior superior iliac spine and this is the anterior inferior, क्योंकि ये anterior side है, right? Now when I'm turning back like this is the posterior side. In the posterior side you have got again two important things. This is called as a posterior superior iliac spine and posterior inferior iliac spine. So anterior superior iliac, anterior inferior iliac. On the back, posterior superior iliac, posterior inferior iliac. I hope can you see all these two projections here, right? Upper one and lower one. So the same projections are over here. So this one over here is called as posterior superior iliac spine and this one over is called as posterior inferior iliac spine. तो anterior का है, ये देखो, ये है anterior superior iliac spine and this is called as anterior inferior iliac spine. Okay, right. Now after that what is this thing over here? See the same picture again, right? So this is how it is. So what is this part which you are projecting over here? So this part which you can see over here, right, this part is called as ischial tuberosity, क्योंकि this entire bone is your ilium, right? So this part is called as your ischium and this one is called as your pubic bone, right? So this part over here which you can see here very clearly, this is called as a ischial tuberosity. Okay, so this one over here is called as your ischial tuberosity, right? Now after that we shall discuss a very important topic, that is ossification centers. Ossification centers. Okay, so in these ossification centers, few important things you have to know. What is an ossification center? This is the point from where the bone starts developing. This is called as ossification center. So within the pelvic bone, within this bone, right, how many ossification centers you have got? Within this bone you have got two types of ossification centers. One is called as primary ossification center, another one is called as secondary ossification center. Okay, so one is called as primary ossification center and the next one is called as secondary ossification center. Now in case of primary ossification center, how many primary ossification centers are there? 3. How many secondary ossification centers are there? 5. Okay, where are these 3 primary ossification centers? First of all, let us mark the primary ossification, uske baad then we'll look at it, secondary ossification centers. Now look here. In this, you know, this is one point here, right? So this is 1. So I'm putting it as primary over here. And the second ossification center is over here. And the third ossification center is over here. Okay, so how many primary ossification centers I have put here? There are 3 ossification centers. So one ossification center is in the iliac bone, one ossification center is in the ischium bone, one ossification center is in the pubic bone. Okay, so let me also divide the iliac, ischium and pubis here, so all of you can see this division, right? So this is the exact division, right? So this entire part is called as your iliac bone. Okay, and after that this entire part is your ischium bone, and finally this part which I'm drawing here, this is your what? Pubic bone. Okay, now so how many ossification centers have drawn? 1 in each of the bones. So let us write it down here. 3 ossification centers. In primary we have got 3 ossification centers, 1, 1 and 1, right? What are those 1, 1 and 1? One ossification center is located in the ilium, one ossification center is located in the ischium, and one ossification center is located in the pubis. Clear? So these are the three ossification centers. Now, very important thing is that when did these ossification centers appear? That we have to discuss. Okay. So appearance of ossification center. So at what age did the ossification center appear? So age of appearance. Okay. So if you look at the age of appearance, the primary ossification center in the ilium, it appeared at 2 months of age, 2 months of intrauterine life. Okay, after 2, what will the thing? 3 months. After 3, the next number is 4 months. So 2, 3, 4 of intrauterine life. During that time, these ossification centers, primary ossification centers appeared. Okay, now let us discuss about secondary ossification centers. I told you secondary ossification centers are how many? 5. So where are these secondary ossification centers? Let us look. Now in this picture, let me point some important structures. You see this iliac crest over here, right? So on the surface of iliac crest, on the top of iliac crest, can you see 2 centers over here? These are secondary ossification centers. How many are they? 2. Where are they? On the surface of the iliac crest. Okay. Next, can you see this Y junction? Can you see this Y junction? Exactly on the top of this Y junction, you have got the next ossification center, that is a secondary ossification center. Again, how many there? Again, the 2, right? Next important thing, another ossification center, can you see on the ischial tuberosity over here? So on the ischial tuberosity also, I can see an ossification center here. This is called as secondary, but how many are there? Only 1. Okay, so overall in the secondary ossification centers, if we have to write, how many we have to write? We have got 2 on the surface of the ilium, that is the iliac crest, on the iliac crest. Next we have got 2 on the Y-shaped acetabular cartilage. Okay, so this is called as Y-shaped acetabular cartilage, Y-shaped acetabular cartilage. And where is the next one? The one is in the ischial tuberosity. So these are 2, 2, 4 and 1 is 5. So completely 5 secondary ossification centers we have got. So very, very important question, guys. Right? So primary ossification centers are 3, secondary ossification centers are 5. Now, very important thing you need to know is that these ossification centers, one or the other time they start fusing. Okay, for example, primary ossification centers are 3. Now, all these 3 ossification centers, when do they fuse? They fuse at 18th year of your life. So, at 18th year of your life, they fuse. All the ossification centers will fuse. Okay, but secondary, in secondary also we have seen 2, 2, 4 and 1 is 5. 5 ossification centers, when do they fuse? They fuse during puberty. Repeat. So secondary ossification centers, right? So secondary ossification centers, when do they fuse? So before we discuss fusion, first of all we discussed here when are they formed, 2 months, 3 months, 4 months. In the same way here, when are these secondary ossification centers are formed is that they are formed during puberty. So these are formed during puberty. And when are they going to fuse? All these 3 will fuse at 20 to 25 years of age. If you are below 20 to 25, still your ossification centers, secondary ossification centers are not fused. Okay, so this is what you need to know regarding the ossification centers. Okay, so you understood all the important things which I have told. I hope you understood the ossification centers as well. Right, now what I'll be doing is that, so this picture which I've shown you here is this weave, right? Now what I will do is I'm just projecting the picture in this way, right? Projecting the bone is this way so that you can look onto the top. Now on the top, what is the shape you see? Can you see an S shape here? Yes or no? See, you can see an S shape over here. So this is the iliac crest which you are looking at right now, and you can see an S shape projection. So the same S shape projection I'll be drawing it right now. Okay, so this is the S shape projection which you can see. Now this part which you can see here is this one, okay, and this part which you can see is this one, and you can see a small elevation like this. So this is a small elevation. If I put it like this, you see a small elevation here, right? So this is a small elevation over there. Now let us look about all the important things. First important thing is that if you look here carefully, here you find two important muscles. See, this muscle which you can see here, this muscle over here is called as gluteus maximus. This is the place where the gluteus maximus is present. Just below that, this is the place where another muscle is inserted, and that is called as erector spinae muscle. So these are the things which you just have to remember it, guys. There is no other trick to, subside all these important things over here. You just have to remember them. So this over here is called as gluteus maximus, okay, and this one is called as erector spinae muscles, gluteus maximus and erector spinae muscles. Second important thing, on the complete end, on the complete edge here, right, exactly here, whatever you can see, this is an insertion of another muscle called as sartorius. And you know what point is this? This is called as anterior superior iliac spine. So from anterior superior iliac spine, your sartorius muscle originates. Okay. Next, you see the iliac crest now. In this iliac crest, there are four important muscles that are attached. Now, what are these four important muscles? See here, this is one. Okay. Next, we have got two. Next, we have got three. And next, we have got four. Okay. From where did I start drawing these lines? So all of you, again, you have to look here. From where did I start drawing these lines? I told you this is your inner surface. This is your outer surface, right? When I'm projecting it like this, so from here I've started 1. Next we have got 2, 3, and here 4. It means from outer surface I am coming to the inner surface. Yes or no? So this will be the outer surface. From outer I have drawn line number 1, 2, again 3, and again 4. Okay, so from outer I am coming to the inner surface. So here also this would be the outer surface and this is the inner surface, or you can also tell the outer surface as the lateral and the inner surface as the medial. So from the lateral to medial, so it would be tensor fascia lata. Okay, after tensor fascia lata, you have got external oblique muscle. Yes or no? External oblique muscle, and again I am telling you this order which I am writing is from lateral to medial. After external oblique, next muscle you have is internal oblique muscle. After internal oblique, the next muscle you have is transverse abdominis. Right? Now all of you look here. This is the lateral side and all the way we are coming down to the medial side. Now, but you have written a mnemonic called TIET. So this was the mnemonic I told you, TIET. Where is TIET? So look here now. This is T, this is I, this is E, as well as this is T. Okay. So the mnemonic goes all the way from the medial side to the lateral side, but the exact order is from the lateral side to the medial side, which you need to know. Okay.